Trintellix, Viibryd, Trazodone. If you've prescribed these medications or been prescribed one but still aren't 100% sure how they really work, what side effects to expect, or when to choose one over another, this video is for you. Hi everyone, I'm Dr. Georgette Kui, a psychiatry provider, and today we are breaking down serotonin modulators. My goal is to make this topic simple, practical, and clinically relevant. Whether you're a medical student or a prescriber or just someone who is curious about how these medications work, this video is for you. In today's video, we are going to talk about what serotonin modulators are, how they work, when to prescribe them. We are going to look at typical dosages, side effects to watch out for. We are going to look at clinical pearls for psychiatry providers to help you feel more confident in your prescribing. And before we dive into this video, if you're a healthcare provider who is tired of spending hours charting, documenting, and finding answers to clinical questions, please listen up. Companion Medical Scribe AI can help you. It can help you generate detailed clinical notes, soap notes in seconds, and not just that, it can help answer clinical questions in real time, suggest diagnosis, medications, dosages, and even ICD-10 and billing codes. You can also use it to generate add-on psychotherapy notes. You can also use it to generate patient instruction emails. Choose from specialty-specific templates or build your own. It is also HIPAA compliant and can be used across different clinical settings and medical specialties. So if you're currently using another AI scribe and you're wondering whether to switch to Companion Medical Scribe AI, start a free trial and experience the difference for yourself. So let's go back to our main topic for today. So what are serotonin modulators? Think of your brain like a city. Serotonin is the messenger, keeping traffic flowing smoothly. Selective serotonin inhibitors like maybe fluoxetine, sertraline, they just help with increasing traffic. More serotonin everywhere. On the other hand, serotonin modulators, they are smarter. They redirect serotonin exactly where it is needed, balancing mood, anxiety, and cognitive function all at once. There are three main ones. We have Trintellix, which is vortioxetine, Viibryd, which is vilazodone, and Trazodone. Before we continue, a quick disclaimer: this video is for educational purposes only and should not be taken as medical advice. Always consult a licensed healthcare professional about your own treatment before you make any medication changes. So how do serotonin modulators work? Let's start with Trintellix. It boosts serotonin and stimulates specific receptors that enhance mood and clarity. It is like upgrading your Wi-Fi router. Clearer signal, smoother connection. You can start at 10 milligrams daily, increase to 20 milligrams if tolerated, or use 5 milligrams for sensitive patients. You may also notice mild improvement in energy or concentration within 2 to 3 weeks, but full antidepressant effect takes about 6 to 8 weeks. The second one we are going to look at is Viibryd, which is vilazodone. It acts like an SSRI plus buspirone. It raises serotonin and activates the 5-HT1 receptor to calm anxiety. It is best for patients with both depression and anxiety. You can start at 10 milligrams for 1 week, then 20 milligrams, then 40 milligrams daily with food. Some patients feel less anxious in 2 to 3 weeks, but mood improvements usually take about 4 to 6 weeks. And the last one we are going to look at is Trazodone. It blocks certain serotonin and histamine receptors that cause restlessness, so it is more sedating. For sleep, you can do 25 to 100 milligrams at bedtime. For depression, 150 to 300 milligrams daily in divided doses. For sleep, it often works within a few days. For depression, it can take 4 to 6 weeks to see full benefit. So when do we use each of these serotonin receptors? For Trintellix, it is best for patients with brain fog or memory issues. For Viibryd, it is ideal for depression with anxiety or emotional numbness from SSRIs. For Trazodone, it is perfect for patients who can't sleep or have MDD with insomnia. Remember to avoid using in severe liver disease with MAOIs or with multiple serotonergic drugs to prevent serotonin syndrome. So let's look at the side effects of each. For Trintellix, it can cause nausea, it usually resolve in 2 to 4 weeks. It can also cause constipation or diarrhea can occur. Occasional sexual side effects less than most SSRI. It is also weight neutral. For Viibryd, it can cause nausea, diarrhea, cramps. It should be taken with food to reduce stomach issues. It can cause insomnia if taken late. Morning dose is best. Less sexual dysfunction and also almost considered weight neutral. Side effects of Trazodone, it can cause drowsiness and dizziness, low blood pressure, falls, especially in older adults, rare, but it can also cause serious priapism, which is prolonged painful erection. It can also cause dry mouth and morning grogginess. And remember that all serotonin modulators, they carry a black box warning for suicidal thoughts in patients under 25. So please remember to monitor closely. So clinical purse for psychiatric providers: start low, titrate slow, especially with Viibryd and Trintellix to avoid nausea. Also educate that they should take Viibryd with food. It improves absorption and reduces gastrointestinal upset. Trazodone should be taken at nighttime only, unless when treating depression with split doses. And also educate patients early that most side effects fade within weeks. So the next time you see Trintellix, Viibryd, or Trazodone on your patient's medication list, remember that they are not just antidepressants, they are serotonin fine-tuners that balance mood, improve thinking, and restore sleep. And if you want to make your clinical documentation faster and smarter, please remember to check out Companion Medical Scribe AI today, which is your AI assistance for notes, quotes, and clarity. And if you're a psychiatric mental health nurse practitioner who is looking for a comprehensive, high-yield review course that will help you confidently prepare for the ANCC or the AMP certification exam, look no further than Dosages PMHMB certification review courses. This isn't just another review course, it is a focused, power-packed preparation program designed to help you truly understand the content, not just to memorize it. It is concise and comprehensive. It covers all the key topics you need to prepare, like scientific foundations, advanced practice skills, diagnosis and treatment, psychotherapies and related theories, ethics, legal principles, research in a clear, easy to understand format. We also have an extensive question bank, hundreds of questions covering the main domains that you'll be tested on the exam, and each question comes with a detailed rationale explaining both why each answer is correct and why others are not. And it has proven success. Thousands of PMHMPs have used this course to prepare for their exams and pass confidently. So whether you're a new graduate or you're retesting after a previous attempt, Dosages PMHMB certification review courses will help you feel prepared, confident, and ready to succeed. So join today and take the next step towards becoming a board-certified psychiatric mental health nurse practitioner. Please follow me for more bedside psychopharmacology and real-life clinical pearls. Thank you so much.